Influenza, or the flu, is caused by the influenza virus. If you'd like to know more about what a virus is, you can see the links that are provided with the video. We call a lot of things the flu. There's the stomach flu, and I had the flu yesterday. But the influenza virus itself produces a fairly distinct set of symptoms. So it's usually high fevers, headaches, cough, congestion, body aches, those types of things. And the illness tends to be much more severe than the typical viral illnesses. So that's why we have medications for it and why we also vaccinate against it. There are two main flavors of flu, so there's A and B, and the virus itself isn't very well built, and it's constantly changing, which is why we have to get a new flu vaccine every year. Influenza primarily spreads through contact and large droplet modes. That means that someone's hands are contaminated with something and they touch an object and then you touch that object, or they touch you, or you share food. That's the contact route. And the large droplets are generally aerosolized when people sneeze or cough. The influenza virus has a relatively short incubation period. So usually between 2 and 5 days, which is likely what makes it more dangerous. Generally, it onsets a lot faster than people's immune systems can respond to it. People are generally contagious for about a day before they start to have symptoms, and then can be contagious for up to 2 weeks, but usually about a week or two after they are feeling better. Unlike other viral upper respiratory illnesses, we do have medications for the flu. They don't work very well, though. So unlike a bacterial illness where antibiotics can kill the bacteria, we can't kill the influenza virus. The only thing that clears the influenza virus is your immune system. What the medicines do is they slow down the viral replication a little bit, and they tend to work a lot better if you start them early on in the illness, within 48 hours of symptom onset. We generally treat people who have a high risk of ending up in the hospital with the influenza virus, so people who have underlying medical conditions such as asthma or immunodeficiency, young children, and older adults. Just like other viral infections, it's mostly just supportive cares until the immune system fights it off. So lots of liquids, Tylenol and Motrin for fever, and for the cough you can try a little bit of honey. So a couple caveats with that. Don't give Motrin to children who are younger than 6 months, and don't give honey to children who are younger than a year. Also, it's very, very important to not give aspirin for the fever. You shouldn't be using aspirin for fever in any children, but especially not for influenza. It can cause a really dangerous syndrome called Rye syndrome. So do not use aspirin to treat the fever. There are two main ways of preventing flu. So the first is medication prophylaxis. So if you have a high-risk individual in your house, and you have the flu, you may want to start them on the medicines. They can prevent the flu virus from ever taking hold. The best way to prevent it really is with the vaccine. It's not a perfect vaccine, and we have to change it every year because the flu changes, but it's better than nothing, and it has been shown to really decrease the rate of hospitalizations, especially in children. So we recommend the vaccine for everybody, but especially for people who have vulnerable family members in their household. If you'd like more information about the flu vaccine, you can see the video that is linked about influenza vaccination with this video.